I'm Dr. Setari. It is a great privilege and honor for me to be talking to Dr. Obaida Batal. This man has changed my life. 4 years ago, when an orthopedic surgeon told me that I have severe arthritis in my left thumb, and that if I don't get surgery soon, I will not be able to perform surgery, Dr. Batal made sure that that didn't happen. I did not have surgery, and today I am still able to perform surgery with essentially zero pain. When I would get up from a chair and fall because of facet syndrome, Dr. Batal made sure that my pain went to essentially zero in my spine. And now I get up and I'm athletic and I'm working out again without any issues.
He'd been suffering with lower back pain for several years, get intensified in the last few years to almost disability and inability to perform long cases. So Dr. Setari trusted me to provide interventional treatment for his back and for his thumb.
Correspond to the areas that he had pain, and then when we inject that spot, he said, "Oh, that's my pain." So we know we are in the right spot.
And he felt the difference. Each treatment provided pain-free experience for several months. With a regimen of 3 or 4 injections, he was able to be pain-free for more than almost a year and a half right now.
Dr. Batal, it's an honor and a pleasure for me to be here and to be talking to you. You're board certified in general surgery. You have a fellowship in interventional pain management, and you have a tremendous amount of credentials. I've actually worked with other doctors who do prolotherapy, with dextrose, with PRP. There's something about the way that you prepare your PRP and the way that you inject that is unparalleled as far as I'm concerned. Tell us about that.
Well, thank you for that introduction. I actually don't deserve it. And you're asking about what's different about it. I mean, I don't think I'm the only one who does it exactly this way, but the PRP has been well misunderstood by either the public or by the people who perform it. Again, everybody spends some blood, they extract some plasma and call it PRP. If they take 10 cc of blood, they spin it, they take 5 cc of that, and they call this PRP, which is okay. PRP stands for platelet-rich plasma. Any plasma that has some platelets, a bit richer than normal amount in the blood, we can consider this PRP. But in order for the PRP to work, you have to have the concentration of the platelet in it should be, at least in my opinion, and also based on the research, at least 7-fold and above. I tend to shoot for 10 folds and 20 folds, depend on the area.
And that means a lot of blood.
That means, yes.
Because I know you've drained me sometimes like a vampire.
Absolutely.
You're just taking giant volumes of blood from me, but that's how you get so much PRP that's necessary in order to inject all of the different areas for me that you need to inject. And this is critical information. There are a lot of doctors doing this kind of stuff, and thank God they are.
Yes.
Because this is fantastic technology. It helps with healing. I've had doctors just take like 5, 10 cc's of blood, spin it down, and say, here's your PRP, and inject just 1 cc into my thumb. It hardly did anything. I know you've injected 3, 4, 5 cc's into my thumb, and my pain went from 6, 7 out of 10 within about a week or two down to 0. It was miraculous. The last time you injected me was over a year and a half ago, and right now, just sitting here, my pain is still 0. But
and
when
that's
I
not easy to get in the thumb too.
Right, yes, correct. It's such a small joint, and it's a it's a joint you constantly use. It's not easy to get.
The location of injection is also of importance, because I cannot, even if I want, to inject 3 cc's of fluid into your thumb. I mean, the maximum amount, I cannot inject more than even 0.2, 0.3, because the joint doesn't tolerate, you know. But we inject around it too. We inject the capsule around it.
Yes.
We inject the tendons around it.
Yes. This is the cutting edge concepts that are important, not the old 15, 20, 50-year-old concepts that are in the textbook. that unfortunately a lot of physicians are still practicing.
Correct.
This is why I enjoy talking to experts like you
Well,
that are on
I
the
want to
cutting edge of
qualify
the
for
field.
experts,
No, you know, you saved me from having to have surgery when I didn't need it, and I'm grateful to you for that. I'm Dr. Robert Setari. Thank you so much for joining me and Master Dr. Obaida Batal. Please, if you have chronic pain, seek out an expert in your area. Get tomorrow's treatment today.